I have 10 years of experience as a doctor, and I have been working with patients with dementia for a long time. Sometimes we become a little agnostic when we believe in some changes on medications. And actually the drugs that have been developed lately for Alzheimer's disease, they just help us to hold the disease. We didn't see a real improvement.
The patients that we normally admit to the studies, the pharmaceutical studies that we have, are patients that are in the mild to moderate stage of dementia, of Alzheimer's. And these pharmaceutical companies are looking to come up with new medications to help people in the very early stages of their diagnosis.
We don't see a lot of changes, positive changes on subjects who are currently enrolled in pharmaceutical companies.
As we all know, there is no cure for this disease. Currently, there's really no what is commonly called a preventative measure for this disease. There's virtually no answer for this disease at this point. So we have over 5 million people diagnosed with this, roughly in the United States. It's costing us well over $400 billion per year to treat these people and to take care of the caregivers. So we're talking about an enormous problem, and it's only getting worse if you believe the Alzheimer's Association numbers. It's going to just go through the roof beyond belief.
It is an epidemic. It's very costly, and it's very hurtful to see someone deteriorate. I think it's a huge impact on the family.
My grandma came here about 4 or 5 years ago. She was diagnosed with Alzheimer's, and by that time she barely could perform any ideas, like going to the bathroom, like asking for food, like asking for water.
Oh my God, I have patients that have more than 50, and I don't want to misunderstand what I'm saying, 50 different medications. Nobody can know what those chemicals are doing in their body.
Nutritional study that we did with Dr. Lewis is looking at people with moderate to severe dementia, which for us was a treat because really the majority of, if not all the studies that we have with the pharmaceutical companies do not even admit or allow us to put in patients that are in the moderate to severe stage. We want to assess how they do when they first come into the study, how their cognitive abilities, at what level they are, and also throughout the study, have there been any changes in their functioning to basically see if the medication is working or not. So we do repeated testing every few months. We repeat the same test to see if there's any change in that person's functioning. Are they stable? Are they getting worse? Or are they getting better? So that's basically been my role here for the past, I want to say, 8 years with these pharmaceutical studies.
When you want to enroll some subject in a clinical trial with drugs, with medications, the first point that you have to advise to the subjects and the family is the possible side effects that you're going to encounter when you're going to participate in different drugs. And those side effects could be from a little rash to really dangerous for the life of people. And we all know that. When we are enrolling patients with glyconutrient, it was really funny because actually we were talking about food. I mean, we just have to be very careful with some kind of allergies, to some food allergies. But the rest of the thing is just food, and that was a real important point. The other thing is that, as I mentioned before, most of the clinical trials, they don't accept people or persons or patients who also have severe or moderate stage of Alzheimer's disease. They are just working with early stage of Alzheimer's disease. But when we're talking about severe stage of Alzheimer's disease, they are a little scared to enroll those patients. And we accept those patients with a very deteriorating health condition.
And so we got the funding to do this little study, so this was our first step. And so we ended up enrolling 34 subjects in this study. We assessed them at 5 different time points: baseline, 3, 6, 9, and 12 months follow-up. We collected blood at baseline and 12 months, and then we did the neuropsych testing at all 5 assessments. And the ADAS-Cog shows at the 9 and 12-month assessments, we actually have incredible responses in our subjects in terms of their improvement in cognitive functioning. Now, if you don't know, the ADAS-Cog is widely considered the standard, if not the best measure to assess people with cognitive functioning, particularly with people with dementia and Alzheimer's disease. So without a doubt, we've used the best, we've used the most objective measure that we can in terms of assessing cognitive functioning in the study. And the fact that we have roughly 48% of our subjects showing improvement at the 12-month follow-up is just dramatic. We have some people who showed dramatic improvements within just a few weeks, others took a few months, but nonetheless, the fact that we have improvement in cognitive functioning over that period of time is dramatic. It's impressive. I'm not saying we found a cure. I'm not even, that would never come out of my mouth. However, the fact that we've shown something that appears to be effective at this point certainly gives us hope. When you improve someone's nutritional status, you turn on the immune system because you're turning on all the vital functioning within the body to allow the body's innate intelligence to be able to say, I've got damage here, in this case being the brain. So the body turns, the immune system turns on, the stem cells turn on. We're giving people the opportunity to have some restored functioning, to have some restored quality of life, to allow that person to experience life again as a whole person, and also, as you know, to allow the caregiver some relief as well, to have that husband, wife, grandmother, whoever the case may be, father, have that person come back to that caregiver and that family to be able to say, yes, our loved one is back and whole again.
By the time she was diagnosed with Alzheimer's, she wasn't able to travel alone. So we had to fly back to Cuba, and we have to come with her in order, for her to be able to get in the plane, not to get lost. And after 3 or 4 months of treatment, she was able to communicate all those ideas that she had lost. She was able to recognize familiars, she was able to recognize places. I'm not meaning like in 100%, but it was amazing the change. It was like passing from the dark to the light. It was almost magical.
I have a patient. She was totally lost. She was confused. She cannot communicate either. She was with global aphasia. She was living in a nursing home. Her husband shared with her 15 years of his life, and he could not admit that he was losing his wife. But she was bed bound. She cannot communicate in any way. She was a global aphasia. She cannot communicate in any way with the environment that was behind her. Her husband was like crazy looking for a solution. In less than a month, the results vary. Some patients start improving in just weeks, others start improving in a month. But most of them, before the 3rd month, you can see the results. And in that particular case, she was looking for her own food in the house. She was walking. She improved her own state gait, and she started to recognize her husband by his name. That was amazing. But the most amazing part was when she finished the study a year, he brought her to the clinic. It was amazing when she arrived and she called me by my name. And I couldn't believe that, because I said, how's it possible? It was so emotional. At the end of the study, we asked him for a blood draw, and when she arrives to the laboratory, the phlebotomist technician was surprised. She couldn't recognize that lady. She said, what is doing? What happened? A person with more than 50 medications, and her health were deteriorating. We can't see any improvement. And when we start doing just a supplement, nutritional supplement, it looks so simple, but the result was so amazing.
By now, she is completely able to travel alone. I'm not saying that she is able, to get a cab or something like that. No, you just go with her, you let her in the row for the plane, and everything goes fine. She's not going to get upset, to get, like people with Alzheimer's. They usually suffer from, from panic because they are dissociated, things like that. And now, no, she is able to behave. as soon as I heard about this product, I talked to my friend here. I enrolled my grandma in the program, and it was a great experience. I would recommend it heartfully for anybody who's in my situation.
They saw the results, they saw the improvements. And you know, some of the improvements, I'm not sure even that the testing captured, because the improvements were at home. The improvements were in simple things, simple daily living that, you know, I think the caregivers would be even more able to really tell you about how they felt that this helped their family members.